Hello and welcome to another riveting webinar brought to you by NACCME. Today's topic is the 2021 Addiction Treatment Program Digital Marketing Plan. We're going to be covering a data-driven and a digital-first roadmap, specific technology and tactics to utilize for growth in your behavioral health organizations. This is brought to you today by Dreamscape Marketing and by the Psychiatry and Behavioral Health Learning Network. So thank you so much for joining us. I am today's host. I am Dan Gemp, your guest speaker. I'm the CEO of Dreamscape Marketing, and we've worked intensively in the behavioral health and addiction treatment space for going on 15 years. We've launched hundreds of treatment center websites. We've run hundreds of campaigns, digital and offline marketing, and we're currently experiencing record volumes of residential level admissions for our treatment center clients across the country. So thank you for joining me. I will be sharing a lot of our internal data, a lot of the actual campaign tactics that have been most successful before, during, and what I believe will prove itself in after COVID times, so that you can properly navigate the current market conditions. A few housekeeping items. This is a sponsored webinar brought to you by Dreamscape Marketing, the greatest digital marketing agency on earth. And today we will have a Q&A session at the end, so feel free at any time to submit a question on the bottom left of your screen. All questions will be answered during the last 10 minutes of the program. For resources, you can actually find a PDF of this presentation and additional resources under the headshot image located on the top left of your screen. For help during this actual webinar, feel free to email Melissa Pangaro at mpangaro@naccme.com, NACCME.com. So without further ado, let's dive into it, okay? This was the year of the digital pivot for healthcare, okay? 2020 was the time where all was revealed, when you either were digitally prepared already and there was minimum impact to your organization resulting from all of the changes brought about during COVID, or you saw substantial and immediate decline at the start of COVID lockdowns and some of these limitations brought on during coronavirus. So whether you said these words, whether you described this digital pivot for your healthcare organization with an excited tone or a defeated one, this depends on what digital marketing you already had in place. And we're going to cover that. I'm going to lay the groundwork. I'm going to talk about some trends and then take you to where things are going. I'm going to show you what to do. So no matter how 2020 went for your organization, because of these changes, because of what's happened, 2021 is actually a year where you should thrive. You're not in the restaurant industry. You're not necessarily in a socially distant, limited industry. This is a year that has gone fully digital first for mental health. New technologies, new adaptations, and very reasonable adjustments you can make to your strategies and budgets to stay ahead of the curve and capture more market share. So how do you thrive in this digital first world? I guess my first question to you is, have you gone digital first? Do you realize that the most research, the most inquiries, most of your marketplace is on the internet? Think about where you spent your time over the last year. Think about your own consumer habits. And think about where you look for medical advice, right? Do you just ask family and friends? Or do you really get into the research, really get into the weeds, and really trust the high-ranking websites and the digital information that you find? So we're going to cover micro issues and macro issues today. We're going to really try to inform your decision-making. I'm going to tell you about the data that we look at in our campaign work and how to get that data. And then really the part I think a lot of you want to hear on the tactical side is budget attributions, right? Hey, Dan, we made some big adjustments last year, some successful, some not. What's the ideal, marketing budget this year? Where should I put dollars towards PPC versus social media and SEO and whatnot? So looking back at 2021 and then projecting the trend ahead, looking back at 2020 and projecting ahead through 2021, you really want to see if you were reacting quickly to shifts in consumer behavior, okay? A lot of this was predictable, right? A quick example I'll give that we'll cover more later is when people started working remote, they spent a whole lot more screen time on full-size computer screens and monitors and less time on mobile devices. Now, still increased usage of mobile devices, but notable conversion increases from advertising at the full screen size. So just one little trend, and I'm going to cover a bunch of those as we go along here. The pandemic trends that are here to stay is a major consideration. So not only were the organizations that were prepared for a digital first world, not only did they thrive through 2020, they don't need to change that much to leverage these new trends and new technologies. They're here to stay. And my quick example there would be telehealth. There's a variety of ways you might apply it to your treatment programs and assessments and such, but that trend is here to stay. Your marketing channel mix. I'm going to really give you my, not just my opinions, my data-driven results that are going to dictate where you allocate your dollars this year, right? Is it SEO? Is it PPC? How do I leverage Zoom and these video conferencing platforms to better reach out to my alumni? And then patient targeting. There were very interesting trends in mental health diagnoses this year. There was a record number of first-time inquiries for substance abuse treatment. There was a much higher than average rate of relapse and recidivism. And so as an industry, right, the substance abuse care industry and treatment industry, your patient targeting, if you left it the same, you actually missed out on the increased demand. You would have been producing the wrong type of content. You would have been running ads to target markets that weren't necessarily growing. And again, my example there, to give you a specific, would be frontline workers. 1 year ago, there was a certain level of demand in that community. From everything we're seeing, there's been a 20 to 30% increase in first-time diagnoses of frontline workers. Okay, they're seeing people die. They're concerned about their own health. They're concerned about bringing COVID home to their loved ones. And this is an ongoing issue. So if you didn't change your messaging or change your programs even to target these audiences, we're going to discuss what you can do to evolve there. And looking at your vendor partnerships, we've had a lot of success and garnered a lot of interesting new data in collaborating and corresponding with billing companies, right? Get the back-end financial data that we need to pair with our front-end marketing and targeting, and a lot of technology integrations. You want to make sure that you're raising your results, not your spend. So everything I say today is going to be about efficiency. I want you to spend smarter, not harder. And there's opportunity as well in 2021. When I talk about thriving, I'm not talking about just growth. I'm talking about expansion. I'm talking about 15 to 25% increase in demand for all levels of care. So the expansion of care models, there's a few new and innovative and even controversial models to look at, like psychedelics and such. So let's dive right into it and why I think that this is a year where the substance abuse industry will be in very high demand and will thrive as a business model. I believe in 2020, we missed the mark as an overall organization, as an overall industry, where this was a record year for admissions for all of our clients. This was a record year of overdose deaths. And my point of confusion there is, wait a minute, if we were all doing such a good job and experiencing this growth, right, then how did we still miss the mark? How was there still a massive, roughly 10,000 person increase in overdose deaths? That means that the demand for care was well beyond that. Think about all of the people that didn't actually die, but did not get the treatment they needed. So looking at the records of 2020, record year for first-time inquiries, a record year for first-time mental health diagnoses, a record year for overdose deaths, a record year for telehealth utilization, okay? We saw volumes for outpatient care of all models, right, inclusive of MAT, double-digit increases almost across the whole country. And so, an increase in localized treatment, less travel, more local. And what we saw on our own campaigns was a record year, right? Through our clients' own websites, we were really only tracking the residential levels of care for detox and residential treatment. But it was a record year again with 15,000 admissions. So the data set I'm sharing today comes out of that. In 2021, what does that mean? Well, it doesn't mean that you missed all of those things. It actually means there's a pent-up demand for treatment. It means that a whole lot of people did not get the care that they need. It means that you're obligated to communicate to them and reach out to them. So how do you turn 2020 from a lose-lose, right, where your audience is limited, you might not have been prepared for a digital-first landscape? How do you turn that into a 2021 win-win, where you're helping your patients where they need you the most, you're getting your messaging and your targets and your marketing into that audience, and any other limitations on your business model, right? If your outreach team can't network in person for several more months, or there's a limitation on your referral resources, then you've got to use digital, right? These people need your help and you need patience, and digital is the fastest and most cost-effective medium for you to capture that market share and communicate with this audience. So I suppose I'll call it the good news, but the opportunity is that the unserved population must be accurately targeted through your marketing efforts. Okay, so we're going to talk about efficiency and this targeting. What has changed, right? I'm going to talk about the consumer a lot today. And the answer is you have changed. The average American consumer, the world got turned upside down and we all got locked inside. And so the hard truth is that everything changed. The way we shop, the way we buy food, the way you interact with Amazon and streaming media. Lord knows I've watched everything there is to watch on Netflix this year. I'm out, so send me some recommendations. But treatment centers marketing strategies, a lot of them were doing just fine. A lot of you were doing wonderful work, very accurate, very efficient. And then things changed. Your consumers started to digest content differently, right? A video-heavy, video-first kind of an approach. You might not have been prepared. You might have done a lot of alumni work in person, right? Life skills and networking and alumni barbecues, whatever that may have looked like to you. And that had to go digital. And there isn't necessarily a digital equivalent to an in-person AA meeting, right? And a lot of that actually removed the anonymity part. And so a lot of treatment centers just didn't realize it. They saw things stay flat, or they saw their marketing doing okay. It didn't register to them as a problem compared to the infection control and safety protocols they wanted to deploy. And so they focused on operations and they missed the mark on this huge opportunity in marketing. So COVID-19 forced a change in how we actually navigate in-person life and how that is paralleled on the internet, right? So this resulted in changes in your behavior, in your media consumption, and this requires a pretty immediate shift in your digital marketing strategy. And some of you probably did this flawlessly. Some of you probably did an excellent job. And some of you just missed the mark or didn't change the recipe. So let's talk about defying the odds, okay? Our industry, and I'm calling it that, okay? If you're good at something and you're helping people, I believe it's okay to make money. This is an industry. So it defied the odds. This industry performed consistently all year long. It performed well, and you very much did rise to safety standards. You should be proud of your teams. You are the frontline workers I was mentioning earlier. And so I was very, very impressed operationally and with the good intentions and with the deployments of safety standards across the whole industry, especially at the residential levels of care. So the second quarter, right? So everything goes into lockdown. This is an official pandemic. This is a global crisis. Traditional business development immediately got decimated. It came to a screeching halt. There was no one to do outreach to. You couldn't go into a hospital and hand off a brochure and just say, hey, call me if anyone needs, once they're stabilized, if they need treatment. You wouldn't necessarily be making your rounds to private practices. A lot of private medical practices were closed. Psychiatric groups, family counselors. And so the usual lines of connection between program and patient, they were broken. And so a lot of these channels, these non-digital channels, it's not that they dried up, they pivoted. You had to find a different way to communicate with those partners. Here's the interesting trend that we noticed. Q2 into Q3, okay, the programs that already focused on digital marketing, the ones that were already driving large volumes of admissions from the internet, they were able to pivot very quickly, right? You just turn up budget A and adjust budget B, and it makes up for the outreach, pause. And then you're able to weather the storm. And during that same time, those that are comfortable with digital deployed digital tools. How many of us have been on Zoom calls and webinars this year, right? So your outreach teams were then able to still do their networking and begin that outreach effort again through FaceTime, Zoom, whatever that looked like, digital versions of alumni events. And then we saw real growth, right? So it wasn't just about weathering the storm. For the overall, portion of the year, the second half of the year, we saw growth. Our strategy team, they saw they were able to rapidly assess the new normal, and that gave rapid access to your patient base. They could get a hold of you through a wide variety of media channels quickly, instantly, and they would convert faster into actual admissions. The shift in marketing strategies and solutions came along with that. So how much SEO were you doing? Should you spend more or less on paid search? Did you adjust your strategies to hyper-local because fewer people were traveling, right? And those local keywords on paid search are actually less expensive. So a lot of groups added efficiency. And the ones that did this best were the ones that minimized the time of disconnection. You don't wait, you don't sit around for 90 days and see if the governor will unlock your state. You basically take control digitally and use these tools to make direct connection instantly. So for those groups that were prepared for this digital first world, there was a very small blip, right? A slight decrease for a week or two. When I talk about a small blip, a week or two decrease in calls, demand. It was just people trying to figure out what was going on. And then a very steady climb back. What's interesting about this is not our first rodeo. We have a lot of data on the financial collapse of 2008, 2009. And that was a massive increase in demand for substance abuse and mental health that resulted. But those that were digitally ready at that time and those that are digital first now, it is a defense strategy, right? A good offense is a good defense. And so you would be more pandemic proof. You will have hedged your risk by properly deploying this digital marketing mix. What did we do? What did we see? You've got to inform these adjustments in real time. You've got to use these efficiencies that you can pull from your modern marketing to inform these adjustments. And so, from our perspective, we very much defied the odds. We saw consistent and steady growth across the board, all business models, all varieties of services, a lot of clients launching new programs after May of last year, met with great success. And it was not specific to the pandemic, okay? In fact, it's not specific to the market as a whole. It's because we're not reacting to the cause and effect. There's no reactive approach to digital marketing that's going to be efficient for you. It's that if you connect your marketing to your business intelligence systems, to your CRM, and then you process your billing data to see, well, okay, which marketing gave me the best paying insurance policies and patients and all of that. If you create that feedback loop and you gain some efficiency through automation, that will future-proof your business. And so it's a built-in warranty on your marketing dollars that you will see immediate data that would cause immediate alarm and you would make real-time adjustments, as opposed to, I'll wait for 90 days, spend $100,000 on PPC and just see what happens, right? So using the pandemic as our example, we've got to look at which sudden effects that you could rapidly recognize, right? What were we reacting to and what did we do? So the first was geography. We saw an immediate and abrupt change in those willing to travel for residential treatment, okay? 20 to 30%. And so this concept of localized treatment, you needed to bolster content with hyper-local geographic keywords, town names, county names, not just cities. And that strategy on SEO very quickly recaptured that market share. So, 10 to 20% of people less willing to travel into your state, but maybe a 20 to 30% increase in local demand. And so we saw a lot of groups, very large, very established groups, pull record levels of local market demand into actual admissions. And we saw a lot of groups that were in destination locations like Southern California, Florida, Texas. They did just fine in pulling local business in directly versus destination travel. So the new realities are this. There are search terms that changed in volumes dramatically. This concept of hyperlocal SEO and a shift in consumer travel, that makes sense. Think about your own travel over the last year. Did you travel more or less, right? It was that simple. And so you would immediately respond to, hey, I think people are going to travel less because a lot of them are actually in lockdown. They can't travel. And a lot of it is, do you want to risk contracting COVID before we even knew survivability and such by hopping on an airplane? So these new search terms, the demographics that were prevalent last year, 2020, and will continue to be through 2021, it required new content or the revision and optimization of the keywords in your old content, right? Telehealth rehab, that didn't increase by a little bit. It increased by over 1,000%, okay? So people that were primarily trying to stay in place and still receive substance abuse treatment pursued telehealth prominently. Virtual IOP, that's a keyword that got no traffic a year ago and tens of thousands of searches a month last year. COVID anxiety. Now, this is an interesting one. First-time mental health diagnoses don't necessarily type in symptomatic addiction keywords. They would type in mental health and self-assessment, self-diagnosis keywords, the way you might look for symptoms of the common cold on WebMD, trying to assess whether it's COVID because you lost your sense of smell, right? So we saw keywords that were converting for primary diagnosis of substance abuse, right? An alcoholic that was searching COVID anxiety. And if you saw that right away, if you saw that massive, rapid increase in demand on these certain keywords, all you have to do is work that into your content and then invite the conversation about self-medicating, what is your home life like during COVID, and you'll get the answers. They will call you and have that conversation. So the usage shifts, I'm talking about device usage. So working remote, everybody's working remote. I am actually broadcasting this webinar from my home office. Haven't been to my office in months. So in this scenario, there is actually less phone, more desktop. Your screen time is being spent on a larger screen. That means the type of digital ads that work change. Display ads were back in play. Email worked very well. And so we saw that anyone that made these adjustments, you didn't have to change necessarily the keywords you were bidding on for your pay-per-click ads. You just had to change what device they were being served to, right? Yes, people are still using mobile devices at record levels, but also we were getting really good, really healthy conversions through desktop at levels we haven't seen in several years, about 5 years. Now, here's a huge shift that I have not heard anyone talking about yet, and I think that we're going to realize that that's, a real lack of foresight. Employment changes and unemployment. So 10 million plus Americans lost their jobs last year. They all have families. Who knows if everybody was on their health insurance through their employer. So the volume of changes, let's say that's a family of 3 or 4, right? We're talking about tens of millions of Americans, 20, 30% of the country that could have changed health insurance last year. That's your market, right? So there may be patients where you might have had a marketing channel that was successful for you, right? Or an EAP program that had a lot of employees, and then they cut 20 or 30% of their employees. And now those employees are no longer on the same insurance that you accept. And so the targeting adjustments, I'm not saying you have to be in network and adjust that way. I'm simply saying the whole concept of employer provided insurance, private insurance, COBRA versus state and federal options. This wasn't a small shift. This was a massive shift. And it did need to be accounted for in your digital marketing. It's going to be a really good opportunity for you this year, because if you made that change and people increase their presence on the private insurance market this year, you're going to see a windfall for the industry. So let's talk about tactics and channels here, right? So that's the marketplace, but what works the best? Why do I talk about organic SEO all the time? Why do I believe SEO is the priority? I am saying this in direct competition to PPC. It's the same human being searching the same keywords, and more people click organic results than paid results. So quite frankly, it is a more qualified consumer group at a higher volume. And so you should prioritize organic SEO because it represents a larger market segment, and you can be good at it or bad at it. So you don't have to necessarily outperform everyone. You just need to outperform your direct competition. 86% of treatment seekers use Google before scheduling their appointment. That's not search engines, it's specifically Google. 76% of your potential patients visited the treatment center's website while searching for the best facility. They were searching for qualifiers on your care. Interesting. That is medical research, not a gullible consumer. So you're not going to trick them. You're not going to be able to make that luxury pitch anymore. This is a medical decision-making process. Leads generated from an online search are 2 times more likely to convert. So would you rather get a phone call or an online lead if the cost is the same, a random, media call from radio or something? Programs who prioritize SEO and specifically hyperlocal SEO are shielded from more costly PPC competition and from sudden market changes, big and small. So when you have a strong organic presence and you have market share, right? Your site ranks, your site generates admissions. You don't have to be as concerned when a pandemic hits. You don't have to worry about what to do with your $400,000 a month PPC budget because that was your primary method of admissions. So I think that, again, even if you're just starting now, this should be your ultimate priority, strong organic SEO. And I don't care if you're a private practice, if you're an interventionist, a social worker, whatever that is, getting your website to rank higher on the non-paid Google search results should be your business's priority this year. That's the best way to go digital first and succeed. It also has a semi-permanent value. For someone else to outrank you, they would have to catch up to everything you've done and surpass you and be better than you at SEO. So we have a client, I was trying to find the most medium-sized example. We have a client we've been working with for about 4 years. They're in a suburban market in a southern state in the middle of the country. And they spent the same amount of money on their organic SEO every year, but it generated compound results. This is kind of interesting. It's very interesting. So 2017 to 2018, their organic traffic increased 211%. That's because before that time, they just weren't doing much. So that's a pretty strong first year. Overall sessions increased 165%. And to scale, their call volumes increased by that same range, by about 221%. That is inbound phone calls through their own website. Here's the interesting part. Same amount of money spent the next year, same budget, same labor, slightly revised strategies, right? And it resulted in an additional 187% increase in organic traffic and an additional 123% increase in call volume. And then the next year, 2019 through 2020, another 131% increase, another 183% call volume increase, okay? So over that period of time, a 3-year growth trajectory, if you looked at your total volumes and total spend, same annual budget, but you're getting 5 times as many calls just 3 years later by prioritizing that strategy. So I'm talking about control of your geographic keywords. I'm talking about going where the consumer is spending most of their time and doing their medical research. I'm talking about a conversion rate that's twice as strong as the next closest channel, right? And it compounds your returns over a near term, right? A 2 to 3 year period. Now, where would I start to get this information from? The data I need. How do I get real strategic with this? I'm not a data nerd. I know Dan's a web geek and he's always using calculators and stuff. It's all about data flow, okay? Your supporting vendors are working on one segment of your larger success. Your internal operators are working on one specialty of your success. But have you considered how the sum of their efforts can be greater than the parts? And I'm going somewhere with this, but the premise is At one point in time, your marketing might be fuel for your jet engine, right? Your marketing is just skyrocketing and you put $1 in and you get $12 out and everything is wonderful. But it might not get more efficient on its own. You might need to take your billing data, right? Who are my best paying patients? What is my best chance to both provide good clinical care and make the most money? Who am I best suited to service? And so potentially the marketing, right, is fuel at one stage, and then it's the jet engine at the next stage, and your billing data is the fuel. And it can add efficiency of spend to your marketing. So here's where I'm going with this. Creating a system, okay, removing roadblocks and automating anything you can to get cleaner data, more rapid decision-making level data, and pairing your data in that, fuel to jet engine phase, working cyclically with your data. So when you pair your marketing and your CRM software, what happens? Okay. You save time. You save a lot of human labor. We've seen clients save over 1 FTE, 1 full-time employee equivalent, by just pairing their marketing, which would be like their call tracking software and their contact forms, having that go straight into their CRM and create a lead record. Okay, that's just one quick example. So where are these roadblocks in your programs, Road, from Google search all the way through admission? Someone's going to do a search, click on your website, right? They land on your site and they read something. What they're hoping to find is an answer to a question. That's called semantic search. They're then going to be so profoundly impacted by your strong marketing content that they will not be able to hesitate to contact your program. They will call you, they will live chat you, they will fill out a contact form, okay? The goal is to schedule an appointment. I'm using the word appointment because it could be a verification of benefits, it could be financial in nature, it could be a utilization review, but what it's going to result in, that appointment is to admit themselves, to be pre-qualified medically, financially, to come in for admission and treatment. So what am I seeing? When I mention this, what am I seeing organizations do that's so profound? We had a record number of requests last year for integrations between the marketing campaign and CRM system, your client relationship management system. That would be your Salesforce, your Keepa, whatever CRM you're using. Okay. Intake and admission systems are automated. A lot of them are, right? And so you can take someone from the point of a Google search until the point they tell you they would like to be a patient, and that can all be auto-magical. But each step must lead the patient to the next one. You need to have a funnel and a logical progression that is as automated as you can make it. We prefer that as customers. That's why we all love Amazon. It's why we all love simple user interfaces and iPhones, right? They actually control what we do, using this data from each step to then identify and remove the roadblock to the next point. So if you realize, hey, I'm getting a whole lot of people up to stage 3 where they're contacting my program and none of them seem to be willing to give me their insurance information or talk about actually becoming a patient. Okay, then you know what to address. Or, hey, I'm getting a lot of people on my website and a ton of phone calls and none of them are qualified financially and none of them are serious about pursuing treatment. Okay, well, that means you're not answering the right questions on your website. That would be a content issue. I can't tell you how many clients tell me that they want their conversion rate is low. I'm only closing, 0.5% of my calls. Do more marketing. Have you considered that the weak point in that system might be the admissions personnel, right? So using a system like this will be very revealing. Is it your marketing that's strong or weak? Is it your admissions staffing that requires more training or was done poorly? And you use this data to remove roadblocks and increase your efficiency and your lead conversions. What does an automated workflow look like in action? So I'm making it sound wonderful and high tech. It's not that hard, okay? What you're trying to do is visualize data that is otherwise invisible to the naked eye. So in automated workflow, you're taking a new lead, you're putting it into the pipeline auto-magically. You're then managing these leads. So you're looking at data to see how well are they progressing through this admissions pipeline. You're trying to optimize referrals. You're trying to say, okay, how do I get the most good fit, clinical and financial leads, essentially, through my system. And then how do I get real-time information? Where did they come from? What keyword did they type in? Who were they referred by? And then you can really focus on getting more of that, okay? You'll find that you actually are best suited to treat a certain substance or gender or community, right? A lot of programs I've seen specializing in first responders succeeded wildly during COVID, right? There was a lot of demand from frontline workers, first responders. We were talking to groups that saw 60% increases in inbound inquiries from 911 call center operators, very specific groups of frontline workers. So leveraging business intelligence, how do you take this data and do something with it? Well, you need dashboards. You need some kind of a quick, easy to digest representation that you don't have to be a data scientist to process, right? Is this number going up or down? Are my calls going up or down? And are my financially qualified calls going up or down? And where did the ones that are going up or down come from? Cut the budgets that are going down, bolster the budgets that are going up, and now you became a data scientist. So this comprehensive view, right, a highly specialized CRM, that's going to give you the information you need, right? Where are your patients really coming from, and how do you really invest in those channels and that automated workflow? What happens when you succeed, when you do this? What happens? So this is really a case study. We had a client, a large residential client, launch during COVID, about February last year. What happens when marketing and CRM can forge this successful partnership? Well, it was so efficient. I would have almost argued that it was overkill. Like, hey, you can do some of that after you get up and running, right? You can build out a call center or your admissions team once your doors are open, right? But no, everything was done upfront, smooth, seamless, automated. And so your new addiction treatment center starts. They begin, they're in business. Immediately upon opening their doors, traditional networking and referral sources halted, right? So, hey, we opened in February. Oh my God, it's March and we are not allowed to go outside. So then they invested heavily in these automated systems. Hey, I want every single call tracked. I want every single contact form tracked. I want live chat. I want to test everything. I want real-time verification of insurance benefits on my website, right? So then it fed into the digital marketing campaign. Now they're trying to rank on Google, generate strong marketing, do paid search, engage in social media, feed all of that data into the CRM, which feeds magically into the EMR, which then is all of the charting they need for billing. So the interesting part was that this accelerated everything, okay? Normally it would take a few months longer for them to rank as well as they did. They would have to do some fine tuning. They'd be getting phone calls, but they might need to adjust them to get fewer Medicaid phone calls or something like that. And so with minimal staff, with fewer human beings than would otherwise have been required because of these automated systems, right? There wasn't someone manually entering every single phone call into software. In 6 months, in the first 6 months in business, they were setting record levels of call volumes and record levels of conversion into admissions from those calls. So what ended up happening was linear, consistent growth week over week, month over month from opening through year end and continues to this day. And so there was essentially no COVID-19 impact at all because their data dictated immediate and rapid corrections, and it gave them quality assurance and efficiency of spend. So when we were looking at all these systems, since they all talk to each other and we could take one individual search and credit it all the way back to one specific keyword, it generated a certain phone call of a certain duration. It took X period of time, 2 hours to run their insurance benefits, and then boom, they were ready to admit or not. By automating these systems, we saw average admissions increases of 31% monthly throughout this first 6 month period. And that was fantastic. You can actually, even if you're a huge established treatment center, you can actually still do this, right? These efficiencies, you could either spend that much less money potentially, or see that much higher return by fine-tuning your digital marketing engines a bit. What happens when you pair your marketing data with your billing data, okay? And I think that a lot of organizations are a little bit too private with their billing data. They don't realize that it's actually one of the cleanest data sets you have. It tells you exactly your cost per everything, your revenue per everything. And so marketing seems like it's a front-end function to operators. They're thinking like, no, I don't want my web geeks talking to my accounting geeks. That's a different crowd, right? But actually, we speak the same language. We speak numbers. And so what's the best scenario? 100 website visits and one high dollar admission? No, it's one website visit and one high dollar admission. And that efficiency, that instead of wasting your time on 99 poorly targeted calls, you can hone in your efficiency, which requires less human beings, which costs you less money and makes you the most money. And you can reinvest that money and provide the best clinical care, and that results in more professional referrals. So the more your marketing and billing organizations, whether it's internal or external, those stakeholders, the more they talk to each other, their combined data set is actually the key to your success. Let them talk to each other. They'll all sign whatever agreements you need for confidentiality. They all have to already be HIPAA compliant and heavily insured, right? So the risk isn't just to you, it's in their business models. Again, even if they're internal resources. So the key is actually that both tactically and strategically, when you pair this front end data of where did all of my potential patients come from with the back end data of which ones actually stayed a long time, right? Which ones have the longest duration stay at the highest dollars, right? Which is also pretty indicative that they're receiving the best care. That's going to make you both more efficient, right? By delivering you optimized solutions and more money. So I like to use this analogy to a slot machine, right? But you're trying to pair data about utilization review, right? How many interested patients can you actually admit? What does this do to your census level? What's your average census level? How long do they stay? Just length of stay data. Your business model itself. Ask your marketing and billing partners, how do we compare to other states and locations, to other outpatient centers, to other MAT clinics, to other residential campuses? Location, right? Do I need to be spending more on my marketing because I'm in a competitive landscape, right? Or should I shift my marketing dollars out of state or to another type of business model, or put it all towards detox and I'll feed my residential rehab program from the detox patient base, right? So your call volumes matter to both organizations. Your call mix, the quality of these inquiries matters. What health insurance they have, and quality of your clinicians. You will get feedback from your billing data on whether or not your patients were getting long-term quality care. And your marketing group needs that data because they can refine the targeting to get you more of the best fit patients that are also receiving the strongest clinical care. And that's where good reviews come from, and that's where alumni referrals come from, and that's where pride from the work your team is doing to try and save people's lives comes from, okay? So this data itself is marketable, not the dollars part, but a lot of people think it's random. They think it's a slot machine, and you pull the lever and you get a lead and you get an admission, and maybe it's a good insurance policy and maybe it's not. But really, the companies manufacturing the slot machine, they know exactly when it's going to hit and what the probability is and how much you should bet with each pull of the lever. So the more you pair those groups, the groups that are putting the data into the machine, the more they can refine your model so that it hits more frequently at higher values. I am not saying that conceptually. I am saying that specifically, okay? What happens when a marketing function in your organization and the billing function can successfully pair these data sets? We have a very normal, very average client that we didn't realize who their billing group was for about 2 years. We'd both been working with this group for a long time. And then they finally allowed us to talk to each other. We'd assigned some documents and confidentiality, and we just simply engaged in dialogue. And this is data from 2020. So this is a small, rural, in-network drug rehab center in the Midwest. They do have all levels of care, and they are in-network. But they were seeking just steady, stable growth. They're like, look, we don't think 2020 is going to be some blowout year. We just want to grow. We'd like to see census growth. We have available beds. Let's see what happens. And so marketing and billing jointly recognized that Blue Cross specifically was the answer to their model. It was not the highest dollar policy by far. I believe it was fourth, but it was the longest average length of stay and fastest approval based on medical needs, so utilization review. And so by diagnosing that, by assessing that, they were able to put all of their marketing dollars towards the demographic groups. There was college students were one target, and the other was a specific manufacturing employer. And so they were able to adjust their marketing to the keywords that those groups would be searching and to the geographic areas where their populations were densest, right? And it led to stable, solid growth all year long, regardless of shutdowns and lockdowns and other conditions, regardless of employment at that manufacturer. And so we then went back and realized, interesting, they're getting a lot of their patients from rehab keywords and recovery keywords, but they've already gone to detox. Let's do a test with budget. We're going to try to get them more front-end acute medical cases, right? Let's get patients in for alcohol and opiate stabilization and see if they will stay throughout the full continuum of care. Sure enough, they did. And so by testing that, we put the marketing dollars towards detox keywords, both organic SEO and paid search in this case. And then we got our data back from the billing group like, hey, yes, we did see a specific increase in detox resulting from those dollars, and it was this much. And so it was no longer a nebulous concept of, hey, let's try to get more detox patients. It was scientific, methodical, and the result was 30% year-over-year growth, and this organization is opening a second location. And this is not a super aggressive private equity funded group. This is a privately owned group that is just happy to be expanding. Let's talk about technology. So this was a year of big tech in all possible ways. So as organizational leaders, as marketing leaders, as executives, as treatment center owners, right, even small practice owners, we must tell our story where it will do the most good. You are not necessarily getting to your audience in the right place at the right time. So in 2021, your marketing needs to factor in not just the what and why, but where in your online marketing. Are you engaging the right way on social media? Are you using alumni apps and technology tools? Not just reaching out to your alumni. You will get way more admissions if you have deployed technology tools for your alumni. Did you leverage Zoom for team communication, recruiting, staffing, whatever that looks like, and as a technology for group meetings and community building? That was critical. And then beyond that, YouTube, right? When's the last time you made a video? When's the last time you used that new source of media to talk about safety standards and protocols, but the person on camera is actually wearing a mask and actually being safe and demonstrating that? Video tours of your facilities, right? If you can't get in-person referral partner tours, are you creating video tours and distributing that content instead of walking in and handing someone a brochure? So I don't want to dwell on this. These are your opportunities, but you have to be using these technologies to truly be digital first. And it means that your spend, your dollars will be more efficient. Your team members will be more efficient. You can capture the results of your outreach team through your website and through these media channels. So wherever you're not investing, take a look at it this year. And I am wrapping up here. I'm on my last few slides, but how has the pandemic permanently affected marketing for the better? What is the opportunity in all of this? And I believe that the trend that you should all be looking at is how much more comfortable you are, how much digital savviness you gained over the last year by being forced to use Zoom, by being forced to use more video chat to keep in touch with loved ones. I have FaceTimed my parents more than I ever have before. They want to FaceTime with their grandchildren, with my kids. So think about just your habits as an engaged consumer on digital, online. And so meaningful connections, that is how we all used technology. That is how you were tested this year. Were you maintaining meaningful connections with patients through technology? And today, when we're looking at those first few weeks and we're realizing there were learning curves and use cases we had to adapt to, today we're seeing alumni apps, telehealth, virtual meetings. These are things we're all just used to now. It didn't take long. And private social media groups, they're surging in popularity, well beyond any in-person equivalents. So these technologies won't be the only choice in the future. There will be evolution. There will be new platforms. There might be something other than Zoom one day. But they have staked a permanent place in our offerings, and you will be using them throughout 2021. Where does this new technology best fit your marketing? So in 2020, a lot of us were intimidated by the digital pivot. You weren't ready for it, or you were ready to get ready for it throughout the year, but it happened suddenly. The programs that are thriving not only adapted and adopted, but they capitalized. They were able to monetize telehealth, okay? They were able to deploy new mobile apps, and it actually gained alumni referrals that they didn't have before. They created video content, and video content has such a long shelf life, right? It will be relevant for several years to come, but you only have to produce it up front. And so there's a big advantage to the organization that engaged in video communication. And then new applications, virtual alumni meetings, while not ideal, not the best for AA and NA meetings, they created an engagement, a safe environment with direct person-to-person engagement, and that is what you require to get referrals and generate admissions. So new patient consultations can be done over video chat. Telehealth can be used simply to communicate over video to establish trust with a prospective patient. So thinking about this, thinking about the opportunities ahead, right? There are new tools, there is new targeting, there are slight revisions you need to make, but there are actually new treatments and new technologies coming. Better patient targeting. Our marketing must connect better in 2021. Basically, the unserved population I was referencing earlier from 2020 needs to be more accurately targeted through your digital marketing. So the CDC estimate about a 10% increase in overdose deaths last year. Not only does that tug at my heartstrings, not only is that sad, it also means that we did not effectively capture those in need in our marketing and communicate their options to them, that treatment works, that addiction is a disease, that they needed to pursue help. In June of last year, in June of 2020, there was a CDC survey that stated 13% who started or increased substance abuse use during COVID. There was a 13% increase in individuals who started or increased their substance abuse during the pandemic. So think about that. This demand, that was mid-year last year, started at a 13% increase. So if your business did not grow by at least that amount, then you weren't helping the people that needed you. You weren't there for that volume of increased demand. The most rapidly growing demographic groups in 2020 looking for residential levels of care were young adults, 18 to 24. That's a little bit predictable. Hispanic and African American populations, very disproportionately. Essential workers and frontline workers, off the charts, right? You might want to consider permanent programs tailored for emergency room nurses and frontline workers. Unpaid caregivers for adults. This was a very interesting niche to see, but high volumes, tens of thousands of people at home tending to their parents, especially worried about putting them in senior living environments and things like that. And then alumni who were in recovery, even long-term sobriety, who were confronted with the additional stresses of the pandemic. And unfortunately, that led to substantial relapse rates. So opioids are still the chief driver. Psychostimulants, meth, that category would be second, followed by cocaine. So what do you need to do in your digital marketing? You need to stay hyper-focused, continuously update, looking at this daily, weekly, and optimizing your website and your content for these updated strategies and trends. You have to expand your online availability. You have to expand your social media groups, and you got to test out some new media. There's some cool stuff going on with social media advertising, with these streaming services. That's called OTT. And even mass expansion in gambling sites and things like that, websites that feature a vice. That is where a lot of your audience is and where a lot of compulsory behavior happens. Launching new demographic tailored programs, right? What do you have for frontline workers? What are your PTSD options? So think about this opportunity at a clinical level and operational level as well. and then hyper-targeting your paid ads. Don't just say, hey, treatment center in Florida, right? Change your ad copy, change your ads to be highly targeted. Treatment center for nurses and frontline workers in Florida. Interesting, right? And take this real-time data and automation and everything I've been discussing and use it to inform your decision-making. Care models. Okay, this one's coming. Psychedelic medicine is coming. It's not just abstinence-based treatment that's going to be the primary option in America anymore, right? The projections are saying this is going to be a $30 billion market. So psychedelic clinics for the treatment of substance abuse is going to be a $30 billion market. In general, residential substance abuse as a whole industry is right around $40 billion, give or take 10%. So our addiction treatment programs, in fact, the best positioned healthcare entities to deliver these therapies, right? Should a formerly abstinence-based treatment center, a large residential program, consider optional programs for psychedelic treatments, MAT programs? And a lot of this comes down to your ethical and clinical standards, but publicly traded companies are leading the charge on this. The FDA is involved, private equity is involved, NASDAQ is involved, big pharma is involved, right? Insurance carriers want it. And so you will see approvals of, psychedelic substances that you've never seen before, that you wouldn't have expected. So pay close attention. There are opportunities in this, good, bad, or indifferent. And behavioral health programs need to get up to speed, build out tailored programs, regardless of whether or not they're for psychedelics, and begin your marketing campaigns. I think you're going to see a massive continuation of expanded telehealth and MAT models over this year as well. A specific example of something you can do on the program side. During COVID, this was interesting because it shouldn't have been specific to 2020, but groups that were in isolation that were seeking help more than other groups, okay, or had a more profound effect on them. You can build a program to a specific demographic, and you need to monitor these trends. But something we noticed in 2020 prevalently, the search terms related to LGBTQ-friendly treatment centers were dramatically on the rise in comparison to any other socioeconomic or demographic group. Okay, that was just one example. There's about a dozen that we keep an eye on. But take a look at that. Take a look at your own inquiries, your own program, and see where you're at. Using real-time data to rapidly serve addiction treatment. So this is a major announcement. This is something that we will be bringing to the market. We're proud to be at the forefront of big data in the space, but we're going to use business intelligence and big data processing to combat substance abuse. We're going to be launching a new service that combines our treatment data from day one until now with real-time nationwide medical transport data. And the result is going to be you'll have software with essentially a little red dot on the map for every single person that was engaged in substance abuse today in the last 24 hours. And you can filter by levels of insurance care, whether they were in a hospital or a private facility, co-occurring conditions that might have been in medical charts. And so this data would be consolidated in a way that can fuel your marketing decision-making all the way through the year and into future years. So think about this, that all of the data, because of this digital first presence over the last year, it has accelerated data collection and aggregation. It has accelerated the development of AI and related big data technologies. And so it's going to become much more informative in much simpler, filterable, sortable formats for your use moving forward. What's on our 2021 checklist, okay? So you do need to know where you're starting from. You do need to take a look at your actual website. We do have a free resource for the industry at dreamscapemarketing.com/website audit. You need to automate your systems, your CRM, your call tracking metrics. You need to readjust your ratios of paid search to content marketing. You should modify your organic content for these local geographies to please Google's algorithm updates. That's called Core Web Vitals, that is launching soon. And this will lead you towards a pillar content strategy where you identify a hierarchy of your most important pages and then the pages that support them as a pillar. And you need more video. Go film a video. Revise the targeting in your paid media, reallocate your budgets to video creation, leverage technology. This telehealth and mobile app stuff is exciting, but it's not that hard to deploy. You'd be surprised. You can just sign up find out how it supports your business model, and take it to market. Increase your desktop and display ads until you see, all widespread lockdowns end. We're going to be remote for a long time to come. I think that that's a trend you can leverage for years. And then you need to pivot to or maintain a digital-first mindset. It will future-proof your business from any other global pandemics to come. Do all of this so that you're not making a new list next year called Advice I Wish I Listened to a Year Ago. So with that, thank you, my friends, for joining me today. Think differently, market efficiently. Again, I put the audit tool available to all of you for free. It's dreamscapemarketing.com/website audit. And then if you do want to schedule a strategy session, we're always happy to lend our 2 cents, help the industry and community as a whole. And if you ever do need help, we're happy to be a resource. So if you'd like to continue the conversation with me, I can be reached directly by phone or email. My number and email are on the screen. So thank you again. I went a little bit long today, so I think that we're going to skip Q&A. So by all means, if you do have any questions, information, do not hesitate to reach out that you're trying to address or pivot in your own digital first strategy. Thank you so much.